everyone. My name is Aisha. I am a senior human resource manager working in Dubai. I've been here for last 13 years. I was suffering from severe dysmenorrhea like heavy bleeding, very much discomforts, horrible back pain, unbelievable stomach pain, heavy cramps and so many. Then I was diagnosed with uterine fibroids, and as per the advice of my gynecologist, I had undergone for myomectomy, which is a surgical procedure. It is through laparoscopic surgery. My fibroids were removed in 2019. My symptoms were okay for more or less 1 year. Then again an unpleasant news came into picture. I was diagnosed again at the same location, another fibroid is growing. That was really an unpleasant news, and I was not having any idea what will I do. Then I decided, out of the fear of the surgery and the pain which I had undergone during the procedure and the recovery period, so I decided to manage by myself with medications. Again it started heavy bleedings, cramps. It is like I cannot put that in the words. It is that much bad. Heavy bleeding, heavy cramps, discomforts, stomach pain, back pain, and so much more. But after a point, medicines were not able to help me. I was forced to take leaves to manage my periods. It was real struggle, real life struggle it was. Then I heard about the procedure called uterine fibroid embolization, a non-surgical procedure where the blood supply towards the fibroids will be cut. I was really excited to hear about this, and I did a detailed study, a detailed research about this procedure, and came to know that Dr. Sandeep Buratoki is an expert in it. I did my MRI and got ready for the procedure with Dr. Sandeep. The procedure is such a simple procedure where the patient will not feel anything but a single prick. But definitely my pain was a bit hard for 3-4 days, but it is not going to be the same for all the patients. The very first period after the procedure itself had given me such a great relief and comfort. I can't put my happiness in the words. Definitely, I am not just saying, it is from the bottom of my heart I am saying this. Such a great relief, such a comfort. There is no pain, no discomfort, no cramps, nothing but just a beautiful day. Recently, I did my follow-up MRI, that is 6 months after the procedure, and the result was really surprising that my fibroid is shrinked 94%, and that was such a great news for me. A lot of women are suffering from these problems these days. They don't have to suffer when we have the safest method, this option in our hand. Definitely when we think of doing this procedure, the greatest question was the cost. But the happiest part is, this procedure is covered under insurance. My sister is with me. She's a doctor as well, Dr. Sunaina Sharif. She was there with me during the whole journey.
Hi, I myself Dr. Sunaina Sharif. She is my sister, Aisha Ansar. She undergone uterine fibroid embolization on 10 July 2023. As a bystander and at the same time I am a staff in that same hospital, I would like to share some experiences I faced at that time. So first of all, I am very glad to see her smile on her face because she suffered a lot due to this fibroid issue for past few years. After 2 to 3 days of the procedure, she suffered a lot of pain actually. But it's not a common thing for all the patients. But some patients will face this kind of issues. But at the time, the Dr. Sandeep Buratoki, he is an interventional radiologist. His approach is very much impressive for us. As a doctor, I can understand how we should deal with the patients during the pain. I would like to thank the whole team behind this procedure, the doctor and the whole nursing staffs and the whole hospital staffs who is very much helpful at that time. And she also is really happy now. The 94% fibroid shrinks, and we are very happy with this procedure.
I sincerely thank Dr. Sandeep for giving me the best solution, the best treatment for the problem which I was suffering for so many years. And my dear beautiful ladies, we have the best solution in our hand now. We don't have to suffer. Keep smiling, stop suffering.